Today, let us discuss about aspirin. Aspirin chemical name is acyl salicylic acid. It is available in tablet form, capsule form, and IV form. In generic, it is known as aspirin. Brand is most commonly used brand in India is Ecosprin. Available doses are 75 mg, 150 mg, 325 mg, 600 mg. It has following properties: anti-inflammatory property, analgesic property, antipyretic property, antiplatelet property. It belongs to non-steroidal anti-inflammatory drug. Whenever there is a tissue damage, phospholipids releases arachidonic acid with the help of the enzyme phospholipase 2. Arachidonic acid with the help of the cyclooxygenase enzymes, it results in the synthesis of prostaglandins. Prostaglandins are generally used to tissue repair by platelet aggregation and vasoconstriction and exerts thrombogenic effects. In arachidonic acid, cyclooxygenase enzymes are two types. COX-1 enzyme is generally generates prostaglandins which are involved in the protection of gastrointestinal mucosa. COX-2 generates prostaglandins that mediate inflammation and pain sites throughout the body. Aspirin irreversibly inhibits COX-1 and COX-2. In case of small quantities, it inhibits COX-1. In higher doses, it inhibits COX-2. Thereby, it inhibits the platelet aggregation and it thins the blood. Mechanism of action: anti-inflammatory action. Aspirin inhibits the activity of the enzyme called cyclooxygenase, which leads to the formation of prostaglandins that cause inflammation, swelling, pain, and fever. Analgesic effect: by inhibiting the prostaglandin synthesis, aspirin blocks the pain sensitizing mechanisms induced by bradykinin, TNF alpha, and interleukins. It relieves the integumental pain associated with the inflammation and tissue injury. Antipyretic action: aspirin reduces body temperature in fever but does not affect the normal body temperature. By inhibiting both COX-1 and COX-2, it reduces prostaglandin synthesis in the hypothalamus and reset the hypothalamic thermostat. Prostaglandin E2 is involved in the temperature raise. By inhibiting the COX enzyme, prostaglandin E2 is normalized. For antiplatelet action, aspirin inhibits the platelet cyclooxygenase by irreversible acylation, thereby preventing the formation of thromboxane A2. Thromboxane A2 is a powerful stimulant in platelet aggregation. Due to this, it prevents the atherosclerosis and clotting. It is used as a prophylaxis in case of myocardial infarction also. Due to its antiplatelet property, it is used in Due to its analgesic action, it is used in headache, backache, toothache, myalgia, neuralgia, dysmenorrhea, rheumatoid arthritis, and pain of cancer and metastasis in bone. Due to its antipyretic action, it is used in rheumatic fever. Due to its antiplatelet action, it lowers the risk of reinfraction in post-myocardial infarction and post-stroke patients. It reduces the transient ischemic attacks, risk for deep vein thrombosis and pulmonary embolism. Due to its anti-inflammatory effect, it is used in osteoarthritis and rheumatoid arthritis. Other therapeutic uses: it is used in colonic and rectal cancer, and it is used in preeclampsia. It is also used in Alzheimer's disease. It is also used in familial colonic polyposis. It reduces the formation of polyps in the colon Due to it gives symptomatic relief. Niacin induced cutaneous flush and pruritus to slow down the cataract progression, and it is aspirin in low doses protect the proteins of the lens against glycosylation and carbamylation. Relief. It also gives relief in dysmenorrhea. Now, adult doses in prevention of myocardial infarction or heart attack, initial dose is 75 mg, maximum dose is 325 mg per day. In case of stent implantation, 325 mg 2 hours pre-operative, then it is followed by a dose of 160. Initial dose, maximum dose is 325 mg per day. Based upon the patient condition, dose is adjusted. In case of pain and fever, initial dose is 325 mg, maximum dose is 650 mg, 4 to 6 hours early. Maximum dose is 4 grams per day. In case of pain and inflammation associated with musculoskeletal and joint disorder, initial dose is 2.4 to 3.6 gram per day. Maintenance dose is 3.6 to 5.4 grams per day. Side effects. Gastrointestinal side effects includes dyspepsia, diarrhea, nausea, vomiting, gastric bleeding, and even necrosis and ulceration. Respiratory alkalosis. Aspirin in high doses causes respiratory alkalosis. Symptoms include headache, vertigo, tinnitus, hyperventilation, nausea, and vomiting. It also results in the metabolic acidosis due to large amounts of ketone bodies. Symptoms include loss of vision, hyperpyrexia, vasomotor collapse, renal and respiratory failure, dehydration, convulsions, coma, and death. Other side effects include increase in bleeding tendency, renal effects. Chronic aspirin consumption causes analgesic nephropathy characterized by chronic nephritis and renal papillary necrosis. It is generally contraindicated in peptic ulcer, allergic patient to aspirin, kidney impairment, liver disease, and in case of pregnant women, in hemophilic patients, hypersensitivity to NSAIDs, and in case of asthma. Some of the serious drug interactions are discussed in this slide. Aspirin plus digoxin both increase the potassium levels in the blood. Aspirin plus ramipril opposing drug effects, potential for reduced effectiveness in lowering blood pressure. Aspirin plus furosemide, aspirin increases and furosemide decreases the potassium levels in blood. Aspirin plus lithium, aspirin increases the levels of lithium by reducing drug clearance through the kidneys. Aspirin plus sertraline either increase the toxicity of the other by added drug effects. Aspirin plus methotrexate. Aspirin increases the levels of methotrexate by reducing the drug clearance through the kidneys. Aspirin plus valproic acid. Aspirin increases the levels of valproic acid by the drug competing method to be bound to the protein. Aspirin plus warfarin. Aspirin increases the effects of warfarin, which leads to the bleeding. Aspirin plus prednisolone increases the toxicity, leads to gastrointestinal ulceration. Seek the medical advice while using aspirin with these drugs. In case of aspirin poisoning due to overdoses, it may lead to the aspirin poisoning. In such cases, it is treated with activated charcoal. Earlier administration of activated charcoal decreases the absorption. And second antidote of the aspirin is sodium bicarbonate. Sodium bicarbonate help to alkalinize the urine and promote the aspirin elimination by the kidneys. In some cases, hemodialysis is also performed to remove the aspirin from the body.